And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thanks so much for joining us. Allergic disease affects nearly 60 million Americans, and this number continues to grow. Jeff Kessler is here. He's president and director of Allergychoices Inc, based in Wisconsin. Jeff, it's so great to see you.
Mabel, thanks so much for the invitation to be here.
Now, when you hear those kinds of numbers, the number of Americans being affected by allergies, do you feel that this is a problem that's going to get bigger, or are we at the time when we might be seeing numbers getting smaller?
Actually, the problem is getting bigger. Unfortunately, over the last 20 years, there's been tracking of an increase in the prevalence of allergies. Due to a lot of different reasons. People don't know exactly why, but the issue is becoming more intense. It might be partly to do with some of the changes with our climate. There's more CO2, which weeds, and there's higher temperatures, moisture. All of those things create more pollen, more issues with mold, which is probably the primary offender as far as allergens go. So that, and then the hygiene hypothesis, we've cleaned up our world. We use hand sanitizers. We have taken a lot of antibiotics. The American diet, all of those things have affected our gut biome, which is one of our greatest defenses with allergies. So all of those things together have really caused allergies to kind of escalate in the last, I'd say, 30 years. And we're particularly tracking food allergies, a lot of that with children. So all of those different reasons are causing this to be a bigger issue, especially for employers, too, who are footing the bill for health care.
Right. I was going to say that when you have that kind of problem getting bigger and bigger, it's going to impact companies and employers. And how should employers be looking at benefits packages then when they have to consider allergic-related diseses in the profile?
Yeah, well, it's interesting, a great question, because when we opened up our presentation to data for our high-performance healthcare organization presentation, we talked about the hidden disease states that are impacted by allergies. We use an iceberg analogy. So asthma, sinusitis, eczema, skin conditions, whatnot, are mostly all triggered by allergies. So what happens is it's almost an unknown or misunderstood area for most employers. So there's just that realization that allergies cause those things to happen. So allergies don't get the same attention that you would diabetes and cancer and heart disease, which for good reason. I mean, those are major diseases. But it's kind of hidden in there. When you add it all together, it's comparable to those diseases as well. So we're trying to help employers understand that, and because it's not even on the radar screen, so to speak, but and in so knowing that, they can look at what they're spending on medications, maybe just everyday visits to the doctor for sinus infections, respiratory infections. All of those things are many times triggered by an allergic disease that's underlying those things. So it's a little bit of awareness, and then then what are they going to do to address that? And that's the other part of what we do with Allergy Choices.
Okay, so are you advising that benefits managers be more educated about this? Yeah. And once they are, what are some of the options available to them? Sure.
Yeah, absolutely. Learning more about this, understanding what the impact is, all of those things are going to help understand what the spend is around this. Also, the other things are productivity impact. If you have a lot of employees, see, when you add this all together, it could be 20% of an employee population. So that's 1 out of 5 employees. And if they're being impacted by this, they need to have some kind of an understanding of what the approaches are to be treated for it. And that's where it gets a little bit tricky, because in the standards of care in the United States, the treatment approaches that are typically used are medications. We have an incredible amount of spending on allergy medications. It's the #1 over-the-counter medicine class there is. And it's not just that, prescriptions as well. We have a rising number of these biologics, newer medications, quite pricey. All of those things contribute to it. The other thing is staying away from what you're allergic to, which becomes really difficult in our normal lives to do that. Even to try to clean up your environment with various strategies for that. So what the best way to treat it is to use immunotherapy, and that's what Allergy Choices is about. We have a protocol that we've developed. Our clinic that we are based on, best in class, has had a protocol for the last 50 years. So we've taken that protocol and we are training other physicians to be able to deliver that protocol to their in an on-site clinic, near-site clinic, direct primary care environment, so that immunotherapy, which is disease modifying, can help them get rid of the allergies. And so that's the difference maker in all this. So it's not just the getting at the symptoms and trying to avoid it, but actually changing the course of the disease. And immunotherapy is very underutilized in the United States. We primarily have injection immunotherapy, shots, allergy shots, and they work great. They're safe, relatively. The problem is that people don't like to do them. There's reactions that they can have fairly regularly. Some can be even quite severe. And it's the inconvenience of going into an allergist's office. So what our model is we use sublingual immunotherapy. We use allergy drops that are taken underneath the tongue. So that area underneath the tongue is an immunologically privileged area. It has dendritic cells that create tolerance to things. So we just stimulate that the same way you would with a shot, small amounts that you gradually increase over time. But that can retrain the immune system to suppress, create tolerance to the things that you're allergic to. You no longer have the response in your eyes, your nose, your sinuses, your lungs, your skin. All of those things can dissipate. And so that's what the difference is. Allergy Choices has a protocol that we're able to train other physicians on and let them be a first-line treatment option.
We hear a lot about children and allergies and being careful about what they're exposed to at schools. We don't talk as much about adults developing allergies later in life. How common is that?
It's more and more common. And I think I was just talking with your assistant here who said that, that wasn't bothered by this, but later in her life, all of a sudden, wow, it's tree season right now, and there's lots of pollen flying around, and she's bothered by that. It's not unusual at all. There's so many factors. We call it the total load. So many stressors on your body that can impact whether or not you're going to become symptomatic. And so, to understand what all those are at different points in your life, and it can be, stressors from having had, like I said, antibiotics and things like that with your immune system. It can be hormonal stressors. It can be, just stresses from life in terms of emotional things that have happened. All of those contribute to this total load. Then you throw in a big dose of pollen or something that you got exposed to, and voila, you have a reaction. And it doesn't matter what age you are. Sometimes, obviously a lot of children are getting it, but we're hearing more and more about the adult onset as well. It can happen either way, and as I said, the prevalence is just growing, period.
Right, right. Well, we look forward to seeing the presentation at the Health Value Awards later on today, of which you'll be recognized there. How are you finding the World Healthcare Congress meeting so far?
The meeting's been wonderful. To come to a place like this with healthcare professionals that are really looking for solutions that are implementable, that are going to make a difference, validated, all of those things. We've waited 20-some years to do this, really 50-some years. That's how long our clinic has been around. to find groups of people like this that are open to looking at things a little bit differently. And so it's been wonderful. The speakers have been great. The organizers have done a wonderful job. It's an honor to be here.
All right, Jeff Kessler, thank you so much for your time today. We appreciate it.
Well, you're welcome. Thanks.
And I'm Mabel Jong. Thank you for watching. Stay tuned. Much more to come.